So we actually really don't do any implants anymore. We definitely don't do cosmetic implant augmentations, but rarely we'll use implants for reconstructive purposes simply because it's sometimes really the only option someone has. But if there's another natural tissue option, those are always going to be our first line options for reconstruction.
I think even in the breast reconstruction patients that we offer implants to them, we've been more, the conversation around breast implant illness and some of the other problems associated with breast implants is one that I think we're more aware of, and we make sure our patients are more aware of. And for some patients, implants are the best option for breast reconstruction after a cancer, but as a part of that consultation, we talk to them about breast implant illness and ALCL lymphoma as possibilities.
And we focus heavily in that conversation on the textured implant versus the smooth implant, and we really don't use textured implants. So we haven't used them for several years. So all of our reconstructions are the smooth implants, which haven't been linked to any of the lymphoma processes.
Ever since this ALCL issue came up, I don't think either one of us has used a textured implant. So
no, it's been several years.
We've eliminated that from our practice, and we do very little cosmetic augmentation to begin with, since our practice is so reconstructive focused. But particularly in light of a lot of this information, it makes it so that cosmetic augmentation isn't something that we're really offering anymore.
Except unless we're talking about a natural option, and
Yeah.
some of those natural options include fat grafting. We can take fat from one part of the body and then transfer it into the breast, but that has some pros and cons that we like to really share with people when we talk about it. But that's certainly an option for cosmetic augmentation. So for people who have had breast implants that are being removed that were actually placed for breast cancer reconstruction, so they've had their implants done for breast cancer reconstruction, and we're taking them out. The question often is, well, what can we do to make the breast reconstruction that involves not an implant? Well, there are natural tissue options that we can use, and one of the most common ones is to use tissue from the lower abdomen, and that's known as the DIEP flap, or the DIEP flap, and it stands for the deep inferior epigastric artery perforator flap. Say that a few times fast. And that's basically a piece of tissue, like a tummy tuck, from the lower belly or abdomen, and we transfer it microsurgically to the chest, and we're able to rebuild the breast and add volume and add skin with no implanted material to reconstruct the breast.
Now, some people will do a total en-bloc capsulectomy, remove their implants after breast cancer reconstruction because they have breast implant illness-associated symptoms, and a reconstruction is not the right answer for everybody. And so for those patients, we'll offer a flat closure, and a flat closure means removing a lot of the excess skin, leaving the patient with a cosmetically, aesthetically nice chest closure.
Liposuctioning up into the chest areas with extra tissue,
giving them a nice clean line closure, because a reconstruction isn't right for everybody. And I think the more important thing to offer patients is the type of surgery that meets their goals. And I think it's an important part for us in the conversation is to be able to offer the patient whatever natural result kind of works for them.